Morning everyone. We are going live from Sakra World Hospital, Bangalore. Today we have Dr. Ashok Kumar, Senior Consultant from Cardiology Department, to discuss and answer certain queries on hypertension. Good afternoon, Doctor. So I have certain questions to you. So, Doctor, what is hypertension and how does it cause?
Hypertension is defined as presence of persistently high blood pressure. Blood pressure is normally mentioned as systolic and diastolic. You would have seen the above one and the below one. When the above one, that is systolic, if it is consistently more than 140 millimeters mercury, and the below one, the diastolic blood pressure, when it is consistently more than 90 millimeters mercury, we call it as hypertension. And the definition varies from various societies or various organizations. For example, in the European Society, they call 140/90 as the cutoff for hypertension. The American Society takes it as 130/80. In general, we follow 140/90 as the cutoff for hypertension. And what causes hypertension, you ask? Most of the cases, hypertension is idiopathic. Idiopathic means for which the cause is not known. It comes as a unknown entity. Very few cases occur due to other secondary causes like presence of narrowed blood vessels, presence of endocrine disorders. All these can cause hypertension as well. They form a very small chunk of the burden of hypertension in the society. Most of the cases of hypertension are of unknown etiology, are not known happens for no known reason to us.
All right. And what are the potential complications in case of uncontrolled hypertension?
That's a wonderful question. So most of the patients are asymptomatic. That means that they don't have any symptoms in spite of having a high blood pressure. So that is why they call it as a silent killer. In spite of the blood pressure being higher, the patients do not have any symptoms as such. Some of them have some headaches, some tiredness, shortness of breath on walking, which was not there before. But most of the patients are asymptomatic or do not have any symptoms. But the hypertension, presence of high blood pressure, keeps on damaging the end organs, what we call it as end organ damage. So the common end organs are the blood vessels supplying the heart itself, blood vessels supplying the brain, blood vessels supplying the kidneys, blood vessels that supply the eyes, and blood vessels supplying the peripheral nerves of the body. So it affects a wide range of organs. In the brain, it can cause strokes. Heart, it causes heart failure and heart attacks. The kidney, it causes kidney failures needing dialysis. In the eyes, it causes loss of vision, which is called as hypertensive retinopathy and peripheral neuropathy. All these are the end organs commonly affected by uncontrolled hypertension.
All right. And what should be one's and adults especially target hypertension level?
Yes. So in general, we say the lower the better, but the target should be always less than 140/90, and it slightly varies from individual to individual. For example, a patient who is diabetic, who has other comorbidities, lower the better. So less than 130/80 is better in such patients who have other comorbidities as well. In general, any BP that is less than 140/90 is a good control. As I told before, the societies vary in this, and lower the better is generally accepted.
All right. Thank you, doctor. And how often one should be monitoring their BP at home or in the clinic?
Yes. So, in general, we advise our patients to have their own home monitoring systems and keep checking the blood pressure. When we initiate the therapy, we ask them to check the pressure once in a week, whenever they are in a relaxed, on a Sunday, for example, morning and evening, and note it down in a paper so that we can review the pressures and make the necessary adjustments of the medications as needed. So once in a week initially when we start the therapy, and once the blood pressure is under control, then maybe we can relax it. Maybe once in a fortnight, or very chronic hypertension patients pretty much under control, maybe even once in a month should be enough.
All right. And what are the lifestyle changes can keep or help someone to keep their BP under control?
Yes, lifestyle changes play a crucial role. In fact, therapy for hypertension is a holistic one. it's not just about taking medications. Each and everything helps to a greater extent. Lifestyle changes and medications all are important. Lifestyle changes are, there are a wide range of lifestyle changes. The primary ones would be patients who are obese should shed more weight, should come to an ideal body weight range. Patients should restrict their salt intake, should include a lot of fruits and vegetables in their diet, should exercise regularly. Sitting is very dangerous, so people who sit at work for many hours should change that, should start an exercise program, exercise, regular exercises, and cutting down on alcohol, quitting smoking. All these things have a huge impact on control of hypertension.
All right. In fact, my next question was on diet. So if you can talk a little more detail about what are the diet changes, how does it play a role in controlling the BP, and what are the potential diet changes one can bring in their life?
Yeah. So hypertension, most of us know, the first thing that comes to our mind is salt restriction. So people should, in general, Indian diet has a lot of salt in it. The recommendation is having less than 5 grams of salt, but in the most conservative estimate, we take at least 9 to 10 grams of salt in a day. So salt restriction is the primary thing with regard to diet, and including a lot of fruits and vegetables. All colorful leafy vegetables and colorful fruits and vegetables must be included in plenty. A lot of fiber content in the food, and having a lot of nuts, fruits adds to the BP control, and everything aimed at weight loss for people who are obese. All these things, in addition to control of blood pressure, cause weight loss, and it's a wide-ranging wellness effect that is brought out by diet.
All right. So the next very important question is on the exercise. How exercise is going to play a role, and how much one should exercise? Because some people, the moment they diagnosed with hypertension, they go into aggressive, on their physical activities. But what is, as a clinician, how much would you recommend?
Good. So exercise is also very crucial as diet. And as you told, people start and then they don't sustain. So anything that we start should be sustainable. The recommendation is a good amount of aerobic exercises, like walking, jogging, cycling, swimming. All these are the ones that are predominantly required, more than weight training. Aerobic exercises are needed. The recommended levels would be some 30 to 40 minutes a day. You should accumulate at least 150 minutes of exercise in a week.
Oh.
So if you exercise for 30 minutes a day for 5 days a week, that should be a good target for you. So start slowly, gradually achieve it, and most importantly, make it sustainable. What I start today after getting a diagnosis of hypertension should be sustainable after 1 year also. So this is the amount of exercise that is expected for health benefits with regard to control of hypertension. Twice a week you can also do some weight training.
All right. The most critical habit, the social habits, alcohol and smoking, how it is going to affect someone and how important it is for them to avoid it.
Both are easy to catch and difficult to leave, so they have a huge impact on the blood pressure rise.
Yeah.
Both cause hypertension acutely. So if you check a blood pressure after having after having smoking, you see that there is a huge sudden spike of blood pressure. Similarly, alcohol, a binge of alcohol causes a sudden spike in blood pressure. So both habits, smoking must be curtailed, must be stopped completely, and alcohol must be also preferably stopped or curtailed to the minimum possible. I should rather say it should better be stopped. So the effects of both these things go beyond hypertension. They affect multiple organ systems in the body in addition to causing hypertension.
All right. Doctor, the last question is about medication. So what are the various medications available for treating hypertension, and how do they work?
Yes. There are several classes of medications fortunately available to us to treat hypertension. And we do use them on a routine basis. Classes of medications include beta blockers, ACE inhibitors, ARBs, medicines that act at the vascular level, like blood vessel level, cause vasodilatation, calcium channel blockers, centrally acting medication. There are a huge armamentarium of medications to control hypertension. The commonly used ones are the ACE, ARBs, diuretics, beta blockers, and calcium channel blockers. So all of them are really good medications. As we all know, we are always bothered about the side effects. Most of them are well tolerated in our population, and they cause significant number reduction as well. And they really act when it is combined with lifestyle modifications. When you combine diet, exercise with medications, the desired benefit is achieved.
Just one add-on question. I've seen many people, especially senior citizens, they try to adjust or their dosage on their wish sometimes. Sometimes they feel their BP is low and they will reduce the dosage. They may skip the dosage.
Yeah.
What do you advise?
I wouldn't advise to do that. You yourself to do that. I would suggest you to reach out to a clinician to seek advice. Generally, dose adjustments or dose reductions especially are made after careful analysis of the individual patient, making sure that their blood pressure is pretty much under control, and dose adjustments are seriously considered when there are symptoms of low blood pressure shown by the patient, lightheadedness, tiredness, fatigue. So these symptoms we automatically reduce our blood pressure, but generally playing with the medications is generally not advised, especially self-induced dose adjustments are generally not recommended.
Okay. Thank you, doctor. Thank you so much for your valuable insights. I'm sure that our viewers are benefited out of this. Thank you, viewers, for joining on this live call. And if you have any queries, please put in your comment. Our experts will get back to you. Thank you so much for watching us.
Thank you.
Thank you.
All.